everyone, and thank you for joining us today. My name is Elena Hansen, and I'm the Telehealth Education Coordinator for the First Nations Telehealth Network. Today, we are joined by Sylvia Eleftheriou, a registered psychologist in Alberta and BC with a master's in education. She is the clinical director at Deep Sea Psychology, and she has experience engaging in community and counseling, support with Indigenous children, teens, and families in Edmonton on Treaty 6 territory, and is currently living in Cowichan on the unceded Coast Salish territory. As the clinical director of Deep Sea Psychology, Sylvia supports a team of psychologists who provide counseling services to Indigenous adults, teens, and children by video call, for example, through the First Nations Health Authority and Non-Insured Health Benefits mental health counseling program. Today, she'll be presenting on maintaining wellness after inpatient mental health care. But first, we have a few things to mention. I would like to begin by acknowledging that our work takes place on historical and contemporary Indigenous lands, including the territories of Treaty 6, 7, and 8, and the homeland, the Métis, and that all the people here are beneficiaries of these peace and friendship treaties. The First Nations Telehealth Network recognizes, honors, and respects the histories, languages, and cultures of the First Nations, Métis, and Inuit who have lived on and cared for these lands for generations, and whose presence continues to enrich our community. For participants attending this session from video conferencing equipment, please keep your microphones muted. For participants on Zoom, you are already muted. Questions can be asked verbally by using the raise hand function on Zoom or typed in the Q&A section as well. We would like to keep questions until the end of the presentation. This session is being recorded and will be publicly accessible on the First Nations Telehealth Network website at www.fntn.ca in addition to today's PowerPoint. Once the session and any additional links are uploaded to the FNTN website, all information can be found under the Library tab or under the latest tab linked to the session recording preview. All registered participants to this session will receive an electronic survey once the session is complete, and I'll also post a link to that survey in today's chat box. We kindly ask that you take a few minutes to complete the survey, as any and all feedback is greatly appreciated. As I previously mentioned, we are joined today by Sylvia to learn about what is inpatient care, why aftercare matters, how you can maintain your wellness, and where you can find support. Without further delay, I'll pass it over to Sylvia.
Thank you. Welcome, everyone, and thank you for joining us today. Before we get started, I want to extend a special thank you to Alana and the whole team at First Nations Telehealth Network for organizing this event for us today. As Alana already introduced, my name is Sylvia Eleftheriou. I'm a registered psychologist in Alberta and BC. I'm living in Cowichan, unceded Coast Salish territory. I would love to see where everyone is joining in from today. So if you don't mind, you can please let us know what territory, what area you're coming in from, just in the chat box there, if you're comfortable with that. I can share a little bit more as we're typing in or as we're settling in. As Alana mentioned, I'm the clinical director at Deep Sea Psychology. We're a group practice made up of psychologists across Alberta and BC. In my role, I mainly support other psychologists who provide assessment and counseling services in person and by telehealth, including through Indigenous Services Canada mental health. As we get into the subject matter today, please be mindful that this content can be distressing. So please pay attention to how you're responding to the material internally and do whatever you need to do to keep yourself well, including taking breaks or stepping away if you. The main focus of our psychoeducational webinar today is about how we can promote or maintain psychological wellness after spending some time in inpatient care. So first, we'll need to develop a deeper understanding of what inpatient care is, what it might look like or feel like, and get a sense of the different kinds of experiences we might encounter through inpatient mental health care. A more nuanced understanding of the different types of experiences we might have as a formal patient and how that might impact us can help us better understand why paying attention to aftercare is so important, how we might go about meeting our needs after these kinds of experiences, and what kind of support resources we might want to keep on hand. The material we're covering today can feel like a lot of information, and it can be potentially overwhelming to try to take it all in. So please keep in mind that you will have access to all these slides after the webinar, so there's no need to try to memorize anything or write anything down. Instead, as we're going through this information together, I invite you to pay attention to your own internal responses and imagination of what these kinds of experiences might be like for you or someone close to you if you were going through them. For example, you might try to pay attention to how these different potential scenarios might feel for you, what comes up for you, what kind of support you might feel that you might need to help navigate these different kinds of experiences that we're talking. First, we'll take a little look at what is inpatient. In a nutshell, inpatient mental health care involves a person staying overnight at a hospital or health center due to the impacts of a mental health condition. How long someone stays depends on their symptoms. Admission to an inpatient care facility can happen in two main ways: voluntary or involuntary admission. Voluntary admission means that you've recognized that you are actively experiencing a mental health crisis. You don't feel safe either with yourself or others due to a mental health condition, and you don't feel like you can cope with the support that's available to you in your community. So you take yourself to a hospital emergency room for an examination from a qualified health professional and seek potential treatment options from there. From that initial assessment, you may then be required to stay longer, or you might not. Everyone's experience with voluntarily seeking urgent care at a hospital emergency room can be quite different depending on your specific circumstance. So I'd like you to meet Tiara, a dear friend with certification in Indigenous Studies with specialization in Indigenous family support, who has graciously offered to share her story and lived experiences.
It was around 2018 when I first admitted openly to like everybody how I was suicidal. And yeah, so I took a month off and went back to work and got fired. And then 2 weeks later, my husband got fired from the same place. And so we ended up back at my parents' place, and that was just not healthy for either of us. And so that's where I ended up, admitting it again and brought myself to the emerge. And like, it just kind of felt like I was just sitting there heavy and like in the waiting area for a long time. And then maybe after a while I was able to sit in like a room. But again, I was just like sitting there for hours and hours. And it was nighttime, like it was the middle of the night. And so it was just kind of, I don't know, honestly, it felt kind of like a waste of time. They're just like, oh, like whoever is not here yet, or it's not their shift until whatever time, and so it was just kind of strange. And like, as you know, it's like I'm already calming down just by sitting there, I guess. Like it was like just like a nurse who's like, who even just like recommended like, oh, call like one of those nurse lines or whatever, like ask a nurse or whatever next time something like this happened.
So as you heard from Tira, sometimes a voluntary visit to the ER during a mental health crisis might not result in staying overnight as a formal patient. She was seen by a qualified health professional and provided recommendations for further support for her to access while staying at home. We'll hear more from Tira's story throughout our time together today. So you may be brought to a designated hospital or health center for examination if a police officer, physician, care provider, or someone else believes that you are suffering from a mental health disorder and may harm yourself or someone else. Under the Alberta Mental Health Act, a doctor, qualified health professional, provincial court judge, police officer, or peace officer all have the authority to legally order someone living with a mental health condition to be apprehended or picked up by police or peace officer and conveyed or taken to a designated hospital or health center and temporarily detained, held there involuntarily. That means that you can be admitted to a hospital for examination by a qualified health professional without needing. There are 4 conditions that must be met in order for that to happen. So in order to be apprehended, admitted, and detained, a person at the to be detained at a hospital without your consent, these 4 conditions will need to be met. So you must be determined to be, 1, suffering from mental health disorder, 2, have the potential to benefit from treatment from the mental health disorder, 3, within a reasonable amount of time, you must be likely to cause harm to others or to suffer serious mental or physical decline or serious physical harm because of the mental health disorder. And 4, it must be determined that you are in need of specific care that can only be provided to you as a formal patient at a health facility. So when a medical assessment is done and those 4 conditions are met, a doctor or a qualified health professional can issue what's called an admission certificate within 24 hours of that assessment. That admission certificate can provide the authorization for you to be apprehended and taken to a designated hospital or healthcare facility. If more than 24 hours goes by from the time of that medical assessment without you being issued an admission certificate, then you must be re-examined in order to be admitted to the hospital. If an admission certificate is issued and a copy is given to you within that 24-hour period, that certificate will then be valid for the next 72 hours. This means that the completion of one certificate by a qualified health professional gives the legal authority for the next 72 hours for you to be apprehended and conveyed. That means taken to a specific facility, and for anyone there to care for, observe, assess, detain, and physically control you while being apprehended and conveyed. If you're not apprehended within that 72 hours, another certificate must be made in order for apprehension and conveyance to a designated hospital to occur. And that will often happen with the help of a. So an admission certificate is a legal document. Some people refer to it as a Form 1. In it, a physician or nurse practitioner gives their opinion that you meet the criteria to be detained, those 4 conditions we talked about earlier. They can only complete an admission certificate after examining you first. Once a physician or a nurse practitioner examines you and completes an admission certificate, it can be brought to a designated hospital or health center for further assessment. Once you arrive there, you can be detained for up to 24 hours. Then a different physician or nurse practitioner will examine you again and may issue a second admission certificate. Once that second certificate is issued, you can be detained for up to 1 month. Then your second examination must occur and a second certificate issued within 24 hours of you arriving at the hospital, or you can't be legally detained any longer. So at least one of those examinations must be conducted by a physician. I hope that makes sense. Admission certificates can also be renewed. So when that happens, it's called a renewal certificate. Renewal certificates must also be issued by 2 qualified health professionals, including at least 1 psychiatrist. So there's another way that this can happen as well. So anyone can go to a provincial court judge and swear an information under oath. This is another legal document. If they believe that you are suffering from a mental health disorder and that you're at risk of causing harm to others or may suffer other significant consequences due to a mental health condition. If the judge believes that that information is true and that there's no other way to have you examined, then the judge can issue a warrant for your apprehension. So a warrant is another legal written order that allows police or a peace officer to take you to the hospital. And that warrant is valid for 7 days and can also be renewed again for another 7. So the police can apprehend a person if they have an admission certificate from a doctor or another qualified health professional, or if they have a warrant from a provincial court judge with the following information on it. It has to have the person's name on it, the reason for the apprehension, who issued it, and when it was issued. That when it was issued is quite important because, like we said, the warrant is only valid for 7 days unless it's renewed again. So a police officer can take a person to the hospital immediately without an admission certificate or a warrant if they have what's called reasonable grounds to believe that all of the following are true. They have to believe that the person has a mental health condition, that this person is likely to cause harm to themselves or others, and that this person needs to be examined for their own safety or for the safety of others, and that it would be too dangerous to that person or to others to wait for a judge to issue a warrant under the Mental Health Act. So if you are apprehended and detained during that first 24 hours in a hospital, you must be examined by 1 or 2 qualified health professionals, depending on how you got to that hospital. To be admitted, at least one of the qualified health professionals must be a doctor. If you were apprehended because a qualified health professional issued an admission certificate, then a second qualified health professional must examine you and determine if you meet the 4 conditions for admission. If the police apprehended you based on reasonable grounds or with a warrant from a provincial court judge, then 2 qualified health professionals must examine you independently, and both need to agree that you meet those 4 conditions for admission. If 2 admission certificates are not issued by the end of that 24 hours, you're free to go, or you could stay voluntarily, and you or your family will then have the right to contact the mental health patient advocate, which will If 2 admission certificates are issued by the end of that first 24 hours, you can be held for up to 1 month. During the hospitalization, there should be regular assessments to make sure that you still meet the 4 conditions of that certificate. At the end of the first month, 2 qualified health professionals, at least one being a psychiatrist, do another independent assessment. If both provide their medical opinion that you should remain at the hospital, then you could be kept at that facility for longer. The first time you receive renewal certificates at the end of the first month, they're valid for up to another month, 1 more month. If you receive a second set of renewal certificates, they're valid again for up to an additional 1 month. Any further renewal certificates from there that you receive, they'll be valid for up to 6 months. If at any time you no longer meet those 4 conditions, the certificates must be canceled by a doctor and you're free to leave. However, cancellations can take some time and depend on when you're able to see a doctor to get reassessed. Okay, so what happens during care? While you're at an inpatient facility, each person's experience will vary. So it will likely involve connecting with a treatment team, which can include doctors, counselors, social workers, or nurses. This can involve evaluation, reviewing symptoms, diagnosis, and treatment planning, including recommended treatment options. While treatment options will be presented, even as an involuntary patient, you still reserve the right to make your own treatment decisions unless you are a minor or a physician determines that you are not mentally competent. So let's talk about that. After examining you, a physician can determine that you are not mentally competent if you cannot understand the subject matter of treatment decisions and you are unable to understand the consequences of making your treatment decisions. If you're a minor or a physician decides that you are not mentally competent to make treatment decisions for yourself, they will ask someone else to make treatment decisions for you. That person is called a substitute decision maker. And that's usually someone you know well, so like a guardian, an agent, or your nearest relative. If you are determined to be mentally competent, that doesn't mean you can leave the hospital. Instead, your stay at the hospital or health center is based on meeting the criteria for being detained, not on your mental competence to make treatment decisions. But unless you are a minor or a physician has decided you're not mentally competent, you always have the right to object to any treatment. If you are a minor or deemed not mentally competent, your substitute decision maker can object to a treatment on your behalf. If any such objection is made, treatment cannot be administered. However, your physician can still apply to a review panel to decide if you should receive the treatment anyway, if they believe it's in your best interest. Also, you can be treated against your will if a physician has decided you're not mentally competent, or if you're a minor, and your substitute decision maker agrees to the treatment. Under the Mental Health Act, if you are a formal patient, you have certain rights. For example, the hospital must give you copies of your admission or renewal certificates, stating how long it lasts and give you the reasons verbally and in writing in simple language why the admission or renewal certificates were issued. As a formal patient, you, your guardian, and or a person of your choice must also be given a written description of the review panel and the name and address of the chairperson and information about patients' rights. As a formal patient, you must also be told about your right to apply for a review panel, to cancel their certificates, and to contact the mental health patient advocate for assistance. Anyone who is issued a certificate under the Mental Health Act has the right to appeal the admission or renewal certificates. Like we mentioned a moment ago, a certified person is not compelled to undergo any treatment while in a facility. This means each person has the right to refuse treatment unless they are deemed mentally incompetent or are under a treatment order, or a review panel has determined that it's in the best interest of the patient. However, if you don't agree with a decision that's being made about you, you can have some decisions reviewed by a review panel, including decisions about whether you meet the criteria for being detained in the hospital in the first place, so your admission certificates or renewal certificates, or whether you have the mental competence to make treatment decisions for yourself. A physician may apply for a treatment order, which requires you to take a specific treatment. However, treatment orders are only given for the least intrusive treatment options available, and all possible treatments must be considered. However, psychosurgery cannot be performed unless a patient agrees. All decisions about certification and treatment orders may also be appealed to a review panel consisting of generally a chairperson, usually a lawyer, psychiatrist, a physician, and a member of the general. If you opt to have a decision reviewed by a review panel, the review panel chair will set a hearing date, tell you the time, place, and purpose of the hearing, and give you a reasonable amount of time to prepare, at least 7 days notice for hearings about your detention. You have a right to be present for any review panel hearing that is about you. You also have the right to receive legal advice before your review panel hearing and legal representation at your review hearing. The hospital must also give you copies of your relevant medical records before a review panel hearing at no cost to you. The review panel meets regularly since all appeals must be heard within at least 7 days of the appeal notice. The certified patient is present at the appeal and may be accompanied by others like a lawyer, family member, or friends. Typically, the treating psychiatrist and possibly the treatment team might be present as well. Both sides present their case for the panel. Then the panel members vote, and decision of the majority is the decision of the review panel. In the event of a tie, often the chairperson votes again. Each patient's certification and treatment must be reviewed every 6 months. Ultimately, if you as the patient are unhappy with the review panel's decision, you can appeal to the Court of Queen's Bench. The Mental Health Act also requires the appointment of a mental health patient advocate to investigate concerns or which you have the right to. So we'll take a look at how to apply for a review panel hearing and how to connect with a lawyer and the mental health advocate in a little bit. How about discharge plan? When you're discharged or released from the hospital, meaning that you no longer meet the conditions for admission, or your certificates have expired and you're free to go, the hospital will notify your guardian if you have one, your nearest relative unless you object, and your family doctor if you have one. Your family doctor might also receive information about your stay in the hospital and recommendations for treatment and care. You'll also be given information and recommendations for your own continued treatment. For example, as you might remember, our friend Tiara was provided with a recommendation to call a certain number to follow up with treatment and programming to support her in the community. So let's hear a little bit more from Tiara about what that was like.
I ended up taking DBT and seeing a psychiatrist really often, like once a month, just kind of like check in as well, I believe. But I did complete at least one round of DBT there, and it was nice and like a somewhat small group. The staff was friendly. They really warm welcome. The small groups too. Like it was nice to be able to like work on these examples together and like lived examples or lived truths. So that way we could also reflect and or even just like after hearing what other people are going through, it's just like a reality check of what you're going through. I did see a counselor for a while there and she was great. From there though, it was like moved to Victoria, go back to school. I did CBT for like anxiety and I saw like a psychiatrist through them. And it was supposed to be short term, but because they knew how much shit was going on, they were really cool about letting me stay and like continue care longer term, different medications and whatever. And so that was really, really refreshing. Now I'm taking DBT and now I'm on my second round with that. And so I like how they even encouraged me to pause to take EMDR in hopes that once I get that rolling or so-called completed, that I can go back into DBT and maybe soak it in with a different lens. Just kind of helps. It is covered through FNHA as well for me, and so yeah, I'm really grateful for that. Like tools that you don't realize until you're again reflecting off what everybody and being wow, this is you feel so low. It's like no, I'm doing a lot better than what I was in Edmonton. Same as with the anxiety doctor, I found another doctor through FNHA, and that was again supposed to be like short term. And so I've been seeing her for like a year and a half now, and she's like, "Holy shit, you're going through a lot. Is it what's going on inside your head or out external? It's a little bit of everything." Really validating.
Well, what happened for Tiara is not what happens for everyone. Sometimes people might be discharged from the hospital with a community treatment order or a CTO. Community treatment order is a legal document that outlines a specific treatment plan that a person is required to follow to receive treatment while living in the community instead of being detained at a hospital. Once a CTO is issued, any admission or renewal certificates are automatically canceled. Usually, a CTO treatment plan can include medications that a person is ordered to take regularly and appointments that the person is required to attend with their healthcare providers. You can be given a CTO if two qualified health professionals, so at least one being a psychiatrist, determines that you suffer from a mental health disorder and believe that within a reasonable time frame, you're likely to harm yourself or others if you don't receive continuing treatment. And at least one of the following conditions have to be true as well, that you are either under a CTO in the last 3 years, at least twice, or for at least 30 days in the last 3 years, you were a formal patient under the Mental Health Act, or you met the criteria to be a formal patient while in a hospital or while being detained in a custodial institution. Or in the past, you acted in a way that led two health professionals, including at least one psychiatrist, to believe that you would be likely to harm others or suffer serious mental or physical decline or serious physical harm because of a mental disorder if you don't receive continuing treatment or care in the community. Or a review panel made an order for you to be issued a CTO. It also has to be true that you live close enough to the type of care that you are determined to need and to the two health professionals as well, and you're believed to be able to comply. A CTO can happen without your or your substitution decision maker's consent if two health professionals, including at least one psychiatrist, determines that you have a history of not following the treatment that they believe is required to keep or others safe from harm caused by a mental health condition, or the CTO is considered reasonable for your circumstances and would be less restrictive than detaining you in a hospital or healthcare center as a formal patient. A CTO stays in effect for 6 months and can be renewed or changed at any time before it expires, and there's no limit to the number of times that a CTO can be renewed for 6-month periods. So if you don't follow the requirements of a CTO, a member of the care team can try to help you follow through. If the requirements continue to not be followed, a health professional can then have a peace officer bring you back to the hospital for examination, where again, you would be examined within 72 hours by two professionals, at least one being a psychiatrist, who then decide if that CTO is still right for you. At that point, after the examination, you might be readmitted to the hospital as a formal patient under a new admission certificate, or you can be returned home under the same or a different CTO requirement, or your CTO can be canceled and you can return home. So it really varies each person's experience. Your CTO can get canceled by a psychiatrist if they believe that it's no longer necessary. You can also apply to a review panel at any time to request cancellation of your CTO if you don't agree with it. The review panel will schedule a hearing again and make a decision after hearing from you, your psychiatrist, and anyone else involved in your Okay, so as we just heard, your experience in inpatient care or someone's experience in inpatient care can really vary in terms of it was voluntary or involuntary, whether treatment happened with someone's consent or against someone's consent, whether there was substitution decision maker or if the person got to make their own decisions throughout the process, whether they needed the help of an advocate or not. There's so many different situations that can happen when someone is in patient care. So when we think about if you're caring for someone who is in treatment, whether it's your child, parent, a friend, a partner, you might consider ways about how you can offer them support. For example, it can be helpful to share with their treatment team things that you know about the person's mental health condition. You can talk to them about their symptoms, the medicines that they're taking, what helped them in the past. It can also be a good idea to ask about the hospital's rules. For example, most hospitals have rules about visiting hours, the number of visitors, phone calls, what personal items you can bring to someone. Some of the rules might feel strange at first, but they're intended to help keep you safe. For example, you might need permission from hospital staff to enter or to leave the hospital because doors might often be locked. Seeing your loved one in the hospital can be really hard or stressful for both you and for them. It's normal to have all kinds of feelings about what's happening. So if you are experiencing hard feelings like worry or sadness or guilt, rather than confiding in the person who is staying in care, you might instead want to talk to a friend, a family member, spiritual support, counselor, someone outside of that immediate situation, so that you can stay in the role of being there to support your loved one and helping them stay hopeful and positive about the treatment they're getting. Giving support and being hopeful may help both people a little bit better. You might also extend support by asking about the discharge. It will often include things that you might want to know. For example, keeping informed about doctor or counselor appointments and a list of medication. So while each individual experience in inpatient care can be dramatically different from person to person, the common thread is that it reflects a time of experiencing a significant mental health crisis. And being released from the hospital, whether that's with a community treatment order or not, the journey to wellness doesn't happen. And just because a health professional determines that they believe you're safe enough, stable enough to leave the hospital, that doesn't mean that the risk of potential harm is over. For example, the Canadian Institute for Health Information shows us that about 12 to 14% of people who are discharged from a hospital after inpatient stay due to a mental health condition are again readmitted to the hospital within 30 days of being released. That means that within 30 days of being determined safe enough to be returned back to community, up to around 14% of people end up getting re-examined and readmitted to the hospital. This graph shows the stats in Canada from 2013 to 2022, and we can see that there is a gradual increasing trend in readmission rate over time, with a significant spike of readmission in 2020, which corresponds with the COVID-19 pandemic, and that rate has stayed elevated since then. This is a good reminder that our external circumstances absolutely have significant impact on our mental health and our ability to cope in the community. Now, the next couple of slides can be heavy as they relate to self-harm, so please be mindful to take care of yourself. If you want to step out for this next piece, please. Probably the most significant reason as to why paying attention to aftercare is so important is that the risk of suicide strongly increases for psychiatric patients in the months right after discharge from hospital or healthcare center. It's important to keep in mind that the periods of psychiatric inpatient care are considered particularly vulnerable for suicide, since as we learned today, hospitalization only happens when a person's symptoms reach a certain critical or severe point that they are more likely to endanger themselves or others. After discharge, that risk can still be quite elevated. And the risk of suicide is not the same across all treatment phases. The highest risk tends to be in the first few weeks, the first few months, immediately following hospital stay. For example, when looking at the rates of deaths by suicide of people with the same mental health diagnoses, those who stayed in a hospital as a formal patient were nearly 12 times more likely to die by suicide in the first 3 months after discharge compared to people who did not stay in a patient care. Another study found that of the people who died by suicide within 2 weeks of being released from inpatient care, over half of those people, about 55%, died within the first week, often before their first follow-up. Research suggests several risk factors that are associated with this higher rate of deaths by suicide following inpatient care. For example, short hospital stays that are less than 1 week, a lack of follow-up care or insufficient follow-up care, a patient having more than one psychiatric diagnosis, self-discharging from the hospital once conditions for involuntary detainment or certificates expired, a history of self-harm or suicide attempts, recent negative life experiences, isolation or living alone, stigma related to mental health, feelings of hopelessness, and demographic factors such as being of the male gender or over the age of 40 are all associated with a higher risk of death by suicide. So understanding the risk factors associated with suicide after inpatient care nudges us toward thinking about ways to protect against that risk of suicide. For example, ensuring that there is immediate and continued follow-up care, meaning within a couple of days at most, would be important, especially when someone has had a shorter stay at the hospital. And reducing isolation and staying connected to supportive loved ones can truly be life-saving. Let's hear a bit more from our friend Tiara about what she feels could have been protected.
Looking back, I kind of wish that they would check in after and maybe even have resources on hand instead of being like, just phone this random number. Like, I don't remember it right now. Like, how the fuck am I supposed to remember it when I'm in a survival mode, you know? Like, my brain's already wherever. I think it would be great if they could check in, if there are other programs or whatever that they could like help you get into next, kind of thing. Like, here, call this number and then like figure it out from there, you know? Where it's like what if I did attempt, like what if I was at that point where like it could have been way, way worse, you know what I mean? Even though I was calm by then, like, who knows, like, anybody who could look calm and whatever, like, sitting there for how fucking long by myself doing nothing, like I was calm enough, but it was just like, who knows, somebody had a panic attack or whatever, like, then again, maybe if I did, they would check in more frequently or have somebody in sooner or something. I'm wishing that like it was more commonly accepted, especially for like my parents' generation, to go to counseling, to try out. Like, I wish there was like an annual thing for parents to even just upgrade and just to know basic like empathy or like conflict resolution. Maybe I wish that I had the vocabulary. Recently learned a year ago that I have ADHD, struggle with reading comprehension, and low vocabulary and poor memory. I mentioned it too. In my early 20s, I was diagnosed with CPTSD, depression, anxiety, psychosis with like extreme stress. It's like more so symptoms or something, and then B personality traits with substance misuse. But as I got older and re-diagnosed or whatever, like a couple of years ago, the last two they didn't agree with. If I had the vocabulary to understand or express myself, that would be great. I wish I had DBT, where it's like, how do you blend emotion with rational mind to create wise mind? It's like stopping, pausing, and then reflecting. And the thing is, I do that all the time to a point where it's like maybe freeze or like there's, you know, waiting for the perfect time, which doesn't happen, you know. It's getting stuff down and whatever and exploding or for no reason apparently. I think if that was readily available for everybody, people would totally probably be a lot nicer.
So now that we know a little bit more about the different kinds of experiences that we can go through during inpatient care, we have a bit better understanding of the risks involved when we get discharged back into the community, what some protective measures can be. Let's have a closer look at how we can empower ourselves to promote and maintain our own mental health wellness after an experience. Understanding our own anatomy and physiology of what happens inside when we are in a state of crisis or unsafety can help us learn how to work with our own nervous system to help us return to or find a sense of internal balance, safety. Your nervous system's primary job is to keep you safe. It is constantly scanning the environment in the background of our minds for signs of safety or signs of threat. When a threat is perceived, your nervous system sends messages to your brain, try to get you to act in ways that might help react to those perceived threats without having to think about it and help you get to safety. And there's a few ways this happens. For example, let's imagine that you're out in the forest alone and you see large, fresh bear tracks. And you start to hear a big rustling sound in the bushes. Right away, your nervous system it might register that this is a potential sign of danger. Your body goes into action mode, your heart racing, muscles tense. You're ready to either fight the bear if it comes to it or run away. This is your sympathetic nervous system at work, preparing you for action. In daily life, this can also be triggered by stressors, big or small. It's the high alert state, and it's not sustainable for long periods. Now, if that bear doesn't go away, or You suddenly realize there's a few more of them, and now you're surrounded. The threat might register as too big to fight or to run from. So you might then go into a state of immobilization, freeze. This could involve trying to stay very still, hoping the bear loses interest. This is your dorsal vagal system at work, putting the brakes on everything to conserve energy and trying a different strategy to survive. In everyday situations, this might look like feeling numb, disconnected, or shutting down emotionally. It's a survival strategy, a great place. In the midst of the freeze response, you might also try to appease the bear. You might start speaking softly, avoiding sudden movements, or even offer it some of your food as a gesture of submission. This is what we call a fawn response. In this context, the fawn response involves trying to please the bear in hopes that it won't see you as a threat. It's a social engagement strategy within a survival context. In everyday life, this might look like a tendency to be overly accommodating to others, people-pleasing, or avoiding conflict at the expense of your own. Mental health triggers in our day-to-day life can push your nervous system into these different states of activation, often without your conscious awareness, so without having to think about it. Recognizing these different experiences of activation can help you understand how stress affects your body and your emotions. When your nervous system gets overwhelmed, you can experience a state of mental health, especially when that state of overwhelm, when that nervous system is overwhelmed for an extended period of time. Now, how can you empower yourself to shift from these stress states to? So the ideal state that we want to be in is the ventral vagal state. Imagine you safely escaped from there, and now you're sitting by a calm river, feeling relaxed and at ease. This is your ventral vagal system, responsible for rest and digest, connect. In daily life, this is where we want to be most of the time. It's a state of calm, social engagement, and well-being. This is where we can engage in play, social connection, and creativity, spirituality, all of these places that we like. By practicing self-awareness and using calming and regulating strategies like deep breathing or mindfulness, you can guide your nervous system back to a place of safety, connection, balance. Skill. The skill empowers you to manage mental health triggers effectively and maintain a more balanced and resilient state. Also improve what we call a window of tolerance, how much stress you can tolerate from the external world before our nervous system shifts into one of the stress states. How much can we tolerate while still being this regulated ventral vagal state? There are many ways to practice this skill or to improve our ability to drop in, access ventral vagal states more readily, and overall improve your felt sense of safety, resilience, and stress tolerance. So it might be helpful to briefly review an example of how to access this place of activation. In a moment, I'll invite you to follow along, practice a very brief guided mindfulness exercise to help activate the ventral vagal system and promote a sense of calm and safety. So if this doesn't feel comfortable for you, please honor your own needs. For those who would like to join in, I invite you to first find a comfortable and quiet space to either sit, stand. If possible, you might close your eyes or soften your gaze. Take a moment to settle in. Begin by first just noticing your breath. Take a few moments to simply become aware of your breath, how your body is breathing on its own without you having to try or think. Notice the natural rhythm of your breath, the gentle rise and fall of your chest or your abdomen. Now, let's take a deep breath in through your nose, allowing your lungs to fill with air. Fill your chest and belly expanding. Then exhale slowly through your mouth, letting go of any tension or stress. Repeat this a couple of times, just focusing on the sensation of the breath as you inhale through your nose, filling up, and exhaling through your mouth. Now you might shift your attention back to the sensations in your body. Feel the points of contact with the chair or the ground beneath you. Allow yourself to be present in the moment, noticing those sensations where the edges of your body surface. As you pay attention to the sensations in your physical body, begin to imagine a scene in your mind or place that brings you a sense of peace and safety. It could be a serene beach, a tranquil forest, or any location where you feel completely at ease. Visualize the details of this place. The colors, the sounds, the smells, the texture. As you immerse yourself in this mental image, engage your senses. What do you hear in this calming place? Are there gentle waves, rustling, or distant bird song? Feel the warmth of the sun against your skin. Stay here just a few moments more. Allow any positive emotions associated with this place to arise. It might be a sense of tranquility, peace, joy, or contentment, or something else. Let those feelings expand within you for just a moment. Now bring your attention back to your breath. Notice if it's become a little bit steady, more calm. With each breath, you are activating your ventral vagus system, signaling safety to your nervous system. When you're ready, you might first take a moment to express a bit of gratitude towards yourself and then gently open your eyes and take a moment to reorient yourself back. This short exercise is designed to give you just a taste of how mindfulness and visualization can activate your ventral vagus system, promoting a sense of calm and safety. You can use similar techniques in daily life to help regulate your nervous system and cultivate a sense of calm. The more we practice things like that, the easier it is to access, the more familiar we are with that feeling in our body, how to come back there. And we can come back there at any time. Additional ways of helping to regulate your nervous system and improve resilience to stress include self-expressing and relaxing activities that help you build a sense of connection with yourself, others, and with. This can include practices like meditating, rest, breathing practices like we just sampled. It can also mean time outside in nature, spending time with others, practices of gratitude, keeping reminders around that keep you connected to sources of hope or inspiration in your life, and connecting with yourself in solitude. Connecting with your support network might include family, friends, teachers, elders, neighbors, counselors, members of your spiritual or cultural communities. And remember to reach out when you need support. Protect against the potential risk of isolation. Finding ways of expressing or discharging challenging emotions or internal energy can include creative strategies like journaling, drawing, eating, dancing, crafting, engaging with music. There's so many ways that we can do this. I'll find ways that fit for us, that feel authentic for us. Let's hear a little bit more from Tiara about what she's found helpful in her own journey.
Just a whole new place, whole new settings helped a lot. It's like making it my own home. Like I was in my early 30s and like my first time ever like totally living on my own. I was starting to get that momentum and find myself again, like being able to do more art. Like I did some painting, I was beading, I got into weaving. I biked a little bit, went camping. Before my grandma passed away, I was thinking of my grandma and like future kids. Like that was a sense of purpose of like doing what I could to hopefully get justice for her before she went home. Like when I did things, it was like I wanted to share my teachings and what I've discovered or whatever, or reawaken her and my future kids. And so since her passing, that kind of it's been lost and faded kind of thing. But it's slowly coming back and being like, okay, like I think I can try to focus on, future kids again, and just kind of like, I guess that's kind of it. Like it's hard to be told, or like, not told, but like encouraged to focus on yourself and be like, no, you got to do it for you too. And when you're used to being the caregiver and helper and whatever, seeing my friends and their kids and being around their kids has helped a lot too, though. Bringing me back into the moment, allowing myself to play, allowing myself to like, yeah, just say to even be there when they grow up. So I'm not used to calling myself like their auntie, Just try to think that way, or that helps a bit. And also, like, I guess there's still questions about like certain like descent, like ancestry and all that, and looking into that and just like making sense of things and just like putting pieces together. I feel like it's a constant journey, and like I've like if I were to backtrack, so my maternal grandma was a residential school survivor, and my paternal side is ancestry is from Vietnam, and so the Vietnam War refugee. And so with hearing all these different stories since childhood, I've been that odd kid that just kind of didn't understand why kids would play and have fun. Trying to focus on like chosen family, like it's been hard to shake that family teaching, oh, family's family and the blood, they're all you have. And it's like, well, our family's been shit. I do want to regain our languages and cultures, to which I feel like that could have prevented a lot of harm. I do see that a lot of the ways has been healing, and that the right people, like it's been genuine, the people I've met through going to potlatches and sweat lodges, or getting smudges and brushings and so on, like that's been incredible, to actually feel like family. My dad's side, they're the same way. So for my siblings to be like to have internalized racism about being Indigenous, it's like we're practically the same on both sides of the cultures and all that. Like all the ladies would cook and clean together, and all the guys would go work and hunt or whatever. He is like, my counselor is trying to encourage like gentle self-compassion, grace and self-compassion. Because I had the opportunity to speak with counselors, but my family was all about secrets, and I know it's from residential school. It's like, and so it's hard just to say it. Like I think whenever I feel like this, I think about my husband's nephews and like how they were raised around toxic parents, and like just to show them, not tell, through actions, that they can be the change, and that there's things outside the box.
Research consistently highlights the protective role of physical activity as well, supporting mental health. Engaging in regular movement not only reduces mental health risks and stress, but also aids in managing pain, preventing fixation on negative thoughts, promoting healthy brain and body function. Movement can be a powerful tool for enhancing memory, attention, concentration, mood regulation, and coping with conditions like depression and anxiety. It also offers an opportunity to connect with nature, friends, and community, and provides a means to discharge internal energy or process. These are real relationships that we have with the external world, and movement can be a way to. Now, I understand that finding time for movement can be challenging. Motivation for movement can be challenging of us, and societal or internalized expectations can sometimes be overwhelming and less. Instead, it can be helpful to shift our focus to checking in with ourselves, always coming back to this idea of connection and what do we really need? What would be authentic right now? So we might ask ourselves questions like, well, how do we want to listening to our body's allows us to choose movements that feel nourishing, whether they're big or small. Again, we have all these ideas of what we're told is the ideal kind of diet, what we should be eating. So we're often recommended to eat primarily whole food diets with lots of plants and unprocessed proteins, complex carbohydrates, brown rice, starchy vegetables. These kinds of foods can give us energy and keep us satisfied for longer than simple carbohydrates found in sugary or processed foods. Lean proteins also lend energy, allow our body to be able to think, react. Good sources of protein include meat, fish, eggs, beans, nuts, seeds. Same with fatty acids as well, which are crucial for proper functioning of our brain and nervous system. Processed snack foods, however, like potato chips, stuff like that, can impair our ability to concentrate. Same with sugar-filled foods like canned soft drinks can lead to ups and downs in our energy levels. However, these are often more affordable, they're more accessible. However, research suggests that they can negatively affect both our physical and even though we might already have ideas of what is the recommended thing, we already know that, doctors might tell us to move more or to this particular diet. However, that's not always what happens or what we feel motivated to do. And for each of us, when we're under one of these stress states, we tend to have go-tos. We tend to have what we tend to do during stressful situations. And that's going to be different for everyone. For some people, we might overdo something or sometimes do something. Same with movement, same with eating. Sometimes if we're stressed, we might be the kind of person who, if we're stressed, we start to restrict food and don't eat. Sometimes if we're stressed, for other folks, we will overeat and tend to use food as a way to cope, to soothe our emotions. Same with movement. We see that sometimes people will, when they're stressed, can get really vegetative and not move. Sometimes when people are stressed, they will go really hard and be overactive. So it's important to kind of keep an eye and see, okay, well, where is my activity level right now? Where is my eating habits right now? Relationship with food and movement. And is that telling me something about my nervous system, my internal state, whether I'm feeling imbalanced right now? Some questions that we might ask ourselves to help us kind of check in with these patterns or see how we're doing. We might think about, well, what is our attitude right now? So just with eating, we're on this page here, what is the attitude right now? Are you stressed, bored? Are you hungry? Whatever the answer is for you, can you meet yourself with compassion and have a tendency to, when we do see I'm doing this because I'm overwhelmed, it's because I'm stressed, then we can start getting self-critical about it. Okay. Seeing if we can meet that with compassion, understanding, oh, this is how we are trying to cope, how we're trying to survive. When we're thinking about foods and noticing what happens when we get triggered, when we get stressed, whether we tend to overeat or undereat, whatever our patterns tend to be, see if we can plan ahead so we can be passionate and caring for ourselves when we do have days where we're not our best. Are there certain or foods that you're able to keep available or around in your home? You might also think of foods that are associated with feelings of connection or meaning or hope or family or something that has positive associations to it. There might be a favorite meal that you had as a kid that would be better, or meals or foods that remind you of your culture or your community, that help you feel connected to something. Preparing or sharing meals together with friends or loved ones can also be a way to help bring awareness, meaning, and connection to your relationship with food, identity, and culture. You might also try practicing mindfulness, same way when we're engaging with movement, when we're at what I actually feel like I want. We might also bring mindfulness into our eating habits as well, slowing down, paying attention to the texture, the smell, the feeling of being nourished, right? Practicing gratitude in the moment, hoping to keep ourselves connected to that ventral vagal system. So another thing that we're often reminded of when we're talking about mental health wellness is about sleep, making sure that we're getting good quality sleep. like with our eating habits, exercise habits, that can often be easier said than done. So thinking about ways of how can we help improve sleep. When we're thinking about how our brain and nervous system work, it tends to make associations really quick. So if bed is a place that we're often restless, up, or on our screen in some way, or this is where we go to ruminate over our problems and to overthink about something, then our brain will start to make that association. Here's the bed, so now I'm going to do all those things. That's not really conducive to sleep. So if we want to start breaking those habits and helping the bed, helping that to be connected to the idea that I'm going to sleep, my nervous system is going to enter into that rest phase. I'm going to start to go down and go to sleep. I want to start to help connect the bed and the bedroom to the association of comforting sleep. So this can mean developing a consistent sleep and wake time, only reserving the bedroom for relaxing activities like sleep or sex. And when we're thinking about how long to sleep, we're generally aiming for around 7 to 9 hours of sleep, but really we're focusing more on getting as much sleep as you need to help you feel refreshed. We know that our sleep can really help us with our mood and regulation. So it's really important to pay attention to how we're going to sleep. If we're trying to address our worries before laying down. So again, I'm bringing that to bed with us, and this can be done by maybe setting some time aside for journaling, processing our feelings in some other ways. We might also try to avoid caffeine, alcohol, nicotine, heavy meals, or going to bed hungry, or daytime napping whenever possible to be a little easier to get a good quality sleep. Okay, we're also often encouraging to pay attention to our providers' recommendations, our healthcare providers' recommendations. Maintaining or promoting your own mental health is not easy work. It's often very challenging. So we always need to be considering how to seek out and who to seek out support from. And that can include finding a therapist, a doctor, a social worker, or some other health professional that you genuinely feel you can trust to support you in your journey. Finding a good match with a health provider is really important in the effectiveness of treatment. So you might ask yourself questions like, well, do you feel that your provider understands your needs and your situation? How do you feel about the treatment options that you're being offered? Do they align with you? It's important to explore what your options are so that you can feel a sense of clarity, agency, and empowerment in your own treatment process. And again, so you can keep maintaining that sense of ventral vagal activation, that sense of safety, that this is a supportive process for you. In this section, we'll briefly review some of the support resources available across Alberta. This is not an exhaustive list, though this is a quick reference guide to some important numbers and websites that can be helpful to be aware of when we're navigating our wellness journey, especially after some time in inpatient care. Okay, as we discussed previously, at any time, if you're a formal patient, so you've been given even just one admission certificate, you may ask for help from any person that's involved in your care, but you always have the right to contact what's called the mental health patient advocate. They can help you by providing you information about your rights, investigating complaints or any concerns that you may have, and helping you or those acting on your behalf, including helping you apply for a review panel hearing. Example of something is happening that you don't agree with, and you want to discuss appealing a decision. The mental health patient advocate here's their information. Like I said, all this information is going to be available to you afterwards. You'll have it. Applications to a review panel are made through what's called Form 12. You can get a copy of this form from one of your care providers or nursing staff. It's also available online, website here. If you need help, another person can fill out the form with you, like a guardian, a relative, or a person who provides care for you. Applications for a hearing can be then sent to the following addresses according to your geographic location. If you are unsure of where to send your application, you can ask your healthcare provider, or you can call the mental health patient advocate's office and they'll be able to. You also have the right to accessing your medical records, and they should be given to you ahead of a review panel hearing at no cost to you. However, if you do need help accessing your medical records, you can contact the Alberta Health Services Disclosure Helpline by phone or by email. Here's their information. So you also have the right to legal advice. If you will be in a review panel hearing, you also have the right to legal representation at that hearing. You may request free legal representation directly on the form used to apply for a review panel hearing. That's on your Form 12. Your request will also be passed along to Legal Aid Alberta. The organizations listed here can provide more information to you on how to connect with a lawyer. So Legal Aid Alberta, Law Society of Alberta, Fairpaw Media and Education also has a free to download brochure on their website summarizing pretty much all of the information that we talked about today in a nice little brochure that pertains to your rights as an involuntary patient. And their link is. And so here are some support resources that you might already be familiar with or might not. So of course, if you're in immediate danger and knowing when to call which one, important. So if you're in immediate danger or someone else is in immediate danger, 911 is the place to call, or you can visit the nearest hospital emergency room. If you're experiencing a suicide crisis or having thoughts or feelings of suicidality, you can call them 988, which is the suicide crisis hotline. They're available 24/7. And also text that number as well. For help advice or information, you can call HealthLink, which is they're also available 24/7, 811 for them. 211 is a helpline and online database of Alberta's community and social services. So they're really a resource, a referral resource. So if you don't know where to call, and you're looking for a specific type of help or type of support, you can call 211 and they'll connect you with the right place that you're looking. So it's also important to find culturally sensitive, culturally informed support lines as well. So these are a list of Indigenous specific crisis hotlines. The AHS Indigenous Support Hotline is a confidential telephone service that helps Indigenous peoples and their families navigate the healthcare system. They provide culturally safe, supportive listening, connections to health resources, Indigenous cultural supports, help with addiction and mental health concerns. The Hope for Wellness Hotline offers immediate help to all Indigenous people across Canada. It's available 24/7 and offers immediate culturally competent support and crisis intervention by phone or online chat. If you ask them, counselors can also work with you to find other wellness supports that are accessible near you. Also ask for support in Cree, Ojibwe, and Nunavut. Residential school and missing and murdered Indigenous women and girls crisis lines are also available 24/7. Indigenous Services Canada also offers several mental health and wellness programs available to both status and non-status. One program to mention is the Non-Insured Health Benefits Program, or NIHB mental health program. It's available to anyone who has a status or transfer. It provides up to 22 hours of counseling services, counseling sessions per 12-month period. Additional hours in that same 12-month period can also be provided on a case-by-case basis. And providers who are able to provide counseling through the NIHB mental health counseling program must also be registered providers with NIHB. So there is a registration process there to ensure that there is some level of cultural awareness, cultural competence. So it's important to ask a therapist that you're considering working with ahead of your first appointment to make sure that they're able to support you through NIHB or through another counseling program through Indigenous Services Canada. We also do have several psychologists at Deep Sea as well who are registered providers for NIHB, by direct billing for. Counseling is also available through the Residential Schools Resolution Health Support Program for both status and non-status Indigenous people who have been impacted by residential schools and intergenerational trauma. It doesn't mean that you have had to have a direct experience with residential schools yourself. This could mean family. This can mean even just having the impact of intergenerational without directly experiencing residential school. So, finding your local friendship center can also be a helpful way to connect with community and culture. Thunderbird Wellness app is a free resource that promotes a strength-based, trauma-informed approach to supporting Indigenous wellness, and it's downloadable apps. So stay connected to some element of trauma-informed reminders to check out. So these links and resources will be available to you after our session today, so you can learn more about each program if you wish. Like I said, that's not an exhaustive list, but just a few important pieces to keep in mind. And if you do have any questions or you're looking for a different resource that was there, please do get in touch. I'm more than happy to connect with you and to help you get in touch with the right resource that's supportive to you. Thank you so much for your kind attention and participation today. We have a few minutes left together. If there's any questions, feel free to let me know. Lana can help us out here.
Yeah, great. Thank you so much, Sylvia, for a wonderful presentation. I thought that was really great and went really in depth in terms of how to manage, that aftercare process. So thank you so much for providing such a wonderful presentation on that. I would like to remind participants that the session has been recorded and will be publicly accessible on the First Nations Telehealth Network website, in addition to the PowerPoint for today. So in case any information may have been missed or you want to revisit, it'll always, or it can be found on our website. I've also posted a link to the survey in the chat box. Again, and all feedback is really appreciated for today's session. And if you do have any questions, please feel free to raise your hand and I can give you access to your mic or type them in the Q&A. Looks like we only have a couple participants, so it doesn't seem to be that there are any questions. But once again, thank you, Sylvia, so much for joining us and for your presentation. And thank you so much to our participants as well for joining this session today and for coming out.
Thank you so much.
Have a great day, everyone.